Well, it's time for a health report, and although she's a bit under the weather, joining us now is Africa 54 health correspondent Linord Moudou with more Africa Vaccination Week news. Hey, Linord.
That's right, Vincent. The 8th African Vaccination Week ends on Sunday, April 29th, as emphasis on world immunization is also ongoing. Experts say although great strides have been made in immunization over the year in low and middle income countries, much remains to be done to ensure that all children have access to key vaccines. Joining us now in the studio is Martha Rebour. She's Executive Director of the United Nations Foundation Shot at Life campaign. Martha, welcome to Africa 54.
Thank you. Thank you very much.
Happy to have you here. Also joining us live via Skype from Abuja, Nigeria, is Dr. Chikwe Ihekweazu. He is Chief Executive Officer of the Nigeria Center for Disease Control. Dr. Ihekweazu, thank you so much for joining us.
Thank you, and thank you for having me on your show.
It's great to have you. Listen, my question to you, Nigeria Centers for Disease Control does not necessarily lead primarily on vaccination. However, the agency works with another national agency to do so. Can you tell us about the type of collaboration between the two agencies and what type of support you provide them?
Yeah, so the Nigeria Center for Disease Control leads on all surveillance and public health laboratory diagnostics of the country. So, all our vaccine preventable diseases, in terms of actually counting the diseases, i.e. the surveillance systems to understand the burden of disease in our country and its distribution, organizing all the other prevention activities other than vaccination, ensuring that cases that are found can be diagnosed correctly. And so we support the National Primary Healthcare Development Agency with all the data on the actual diseases, while they then plan both routine vaccination and campaigns to address these diseases in our country.
Oh, great. And let me come to you, Martha. Shot at Life is a campaign, a call for action to help children get more vaccination around the world. Can you tell us what it consists of and why it was so important to start such an initiative?
Yes, sure. So 1.5 million children a year die of vaccine-preventable diseases, and we think this is unacceptable. So Shot at Life was started to help decrease this the number of childhood deaths and to raise awareness around what a great investment vaccines are.
And Dr. Chikwe, you talked about the work that you do in terms of helping in the prevention of some diseases. We saw that in Nigeria last year. Even up until now, there have been an outbreak of meningitis. Okay, and meningitis is a vaccine-preventable disease. So what has been the main contributing factor in this outbreak that we've seen?
Yeah, so we had a fairly large meningitis outbreak last year. This year, the outbreak, we've responded a lot earlier, and we've managed to keep the case count much lower than last year. Now, the predominant strain for the outbreak we had last year and this year is meningitis C. Now, there is not a commonly available vaccine for meningitis C. The one that does exist is extremely expensive. So we're left with this specific strain to really scramble and bring in vaccines as we need to, supported by a WHO program called the ICG. So the vaccines that are available for this specific type of meningitis is simply too expensive to afford on the public health system. So what we are trying to do in Nigeria, while responding to outbreaks as they happen, through reactive vaccination campaigns led on by MPACDA, I think there's also a big international advocacy required to bring down the costs of these vaccines or develop vaccines that are more affordable to countries where diseases like meningitis and its various serogroups present. So while we're doing a lot of work to manage the local context, respond to these outbreaks, try and prevent them as much as possible, the most effective tool to prevent meningitis C outbreaks is a vaccine, and the currently available vaccine is simply out of reach of our public sector in Nigeria.
That's an interesting point that Dr. Chikwe raised about the access and the cost of the vaccine. And can you tell us, Martha, are there some specific vaccines that are being supported in the Shot at Life campaign?
Yes, sure.
Okay.
So we focus on 4 diseases, polio and measles, because those are 2 diseases that we can actually eliminate in our lifetime. So in Africa, polio is only left endemic in Nigeria, in fact, and the other 2 countries are Afghanistan and Pakistan. And we focus on measles because until the year 2000, measles was the leading cause of death for children under 5. The global health community came together. Measles deaths were reduced by 84%. So we know when we come together as a global health community, we can tackle unnecessary deaths by these diseases. The other 2 diseases we focus on are rotavirus and pneumonia. And similar to meningitis C, historically, these are very expensive vaccines. They also happen to be the diseases are the 2 leading killers of children under 5 right now, which is why we focus on those diseases. There's a wonderful public-private partnership called Gavi, the Vaccine Alliance, which in fact, when the market wasn't working, Bill Gates and some other visionary leaders came together and said, we need to provide incentives for pharmaceutical companies to make these vaccines more affordable. So it's almost a wholesale Costco type model where when there's a guarantee to buy in such large bulk, so the pharmaceutical companies know that they have these guaranteed orders and can also have their facilities to be able to make these millions of vaccines. You have to change over your whole plant. Then they can offer them at a more affordable price. So countries such as the US and the UK, and as I said, the Gates Foundation, come together and make a lot of these vaccines affordable, along with pharmaceutical companies. So that's a great example of a public-private partnership that's really working to increase access to, as we said, some of these vaccines otherwise would not be affordable for people in low-resource countries.
Yes, and Dr. Chikwe, I wanted you to react on polio. Martha mentioned polio. Where do things stand in terms of polio eradication and vaccine distribution?
So our sister agency, the National Primary Healthcare Development Agency, has worked extremely hard in the last 2 years since we had the last case in 2016, July 2016, and we have really pushed, extremely hard to cover most of the country with repeated vaccination campaigns. Thankfully, we haven't found a single case subsequently. And we really hope that this is really the end of polio in Africa, in Nigeria, obviously, and in Africa. Now, the challenge really post-elimination will be to sustain vaccination for as long as is necessary, but also now refocus attempts and our efforts at all the other vaccine-preventable diseases. And to do that, you really need an integrated response, including prevention, surveillance, laboratory capacity. And so we need to build out the infrastructure that we've developed for polio to really have a horizontal system with which we can address all the other vaccine preventable and also the non-vaccine preventable diseases. Because ultimately, our goal for all infectious diseases is to eventually have a vaccine. So as we use innovative mechanisms like was just mentioned, Gavi and the rest of them, to increase access to vaccines that are already available, we also kind of need to push very aggressively to develop new vaccines to diseases like Lassa fever in Nigeria currently, for which there's no currently available vaccine.
Yes, Lassa fever has no vaccine. So can you tell us what is being done? Where do things stand with the outbreak?
So we've managed we've had a consistent decline of cases for 6 weeks now. Last week we had a single case, so that's the lowest case count since the beginning of the outbreak in January. So across the country, we've really mobilized ourselves to respond to this. Now, Lassa is a very complex and very clever virus. It's well settled in our environment, has a very clever host, a specific type of rodent, and given the socioeconomic and population in Nigeria, it's not a very easy virus to deal with. However, I think we've learned a lot from this particular outbreak. Various professions have come together, from virologists, anthropologists, and we will use the knowledge that we have gained to prepare better for next year.
So Martha, let me ask you, with the Shot at Life campaign, how do people on the ground help implement this? What is the model in terms of implementation?
Yeah, thank you. That's a great question. So Shot at Life is part of the UN Foundation. So the UN Foundation is a nonprofit organization that supports the work of the UN. So Shot at Life is not actually on the ground. We work through our partners at UNICEF and WHO, who work very closely with ministries of health. So it's a very close collaboration. WHO tends to be more on the surveillance and laboratory side. UNICEF can be everything from the procurement to training of healthcare workers, depending on the specific situation of the country.
That's fantastic. And Dr. Chikwe, I will leave you the last word, given that we are getting ready to close. What are some of the lessons learned from the outbreaks, whether it's meningitis or Lassa, that perhaps the NCDC is taking in consideration to prevent future outbreaks very quickly?
So we've learned that a multi-sectoral, multidisciplinary approach is critical to dealing with the outbreaks that we're facing and infectious diseases in our communities. We have to learn about how societies work, which is why we're working increasingly with social scientists and anthropologists. We've got to learn from vaccine scientists. We've got to learn from public health epidemiologists and pool all this knowledge together in a consistent and coherent way to build the science led by Africans to deal with the diseases that primarily occur in our context. So it's by pooling together the various resources that are available to us.
Collaboration is key indeed. We have to leave it there, Dr. Chikwe. Thank you so much for joining us from Abuja.
Thank you very much.
Martha, thank you so much. It was a pleasure to have you.
My pleasure.
And that's Martha Rebour. She's Executive Director of the United Nations Foundation Shot at Life campaign. We also thank Dr. Chikwe Ihekweazu. He is Chief Executive Officer of the Nigeria Center for Disease Control. And that's our health report for today. To stay in touch, find me on Twitter at Linord Moudou. Vincent, back to you.